Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today's topic is breast health. In addition to breast cancer, what are some of the most common breast conditions?
The most common things that I see that are not cancer are generally either an abnormal mammogram that ends up being benign, a cyst, which is also quite benign and does not increase the risk of breast cancer. In young women, I very commonly see what we call fibroadenomas, which are benign lumps in the breast that may be treated surgically or not. And this other entity, which is probably the most common, called fibrocystic change.
We know that breast cancer is diagnosed through mammogram screenings. How are these other conditions diagnosed?
Most of the time, patients come in, they felt something that was odd or different. It might have been a painful lump. So cysts, for instance, are most often painful to touch. They feel soft and very round, and so the patient notices that there's this painful area, and then when I examine them, I see that they have a big cyst, and that's easily taken care of.
How do you treat a cyst?
Most of the time, if the patient's not having any symptoms at all, we don't need to do a thing about it. It'll go away on its own. It's quite common, especially in women in their late 40s and early 50s. But sometimes when it is painful, and patients come in to see me for that, then all I'll do is stick a small needle in the cyst, very small, like getting blood drawn, even not as bad as getting blood drawn, stick a needle right in that cyst, drain all the fluid out, and the lump goes away.
What types of changes might raise a red flag, prompting a woman to speak to her doctor?
Sometimes there can be various kinds of changes. The most common initial change that we see, though, is not something that's going to be obvious to the patient themselves. That gets back to that abnormal mammogram that I was talking about. Most breast cancers nowadays are actually diagnosed by finding an abnormality on a mammogram. That's ideal for us because that means the cancer is not big enough to be seen visually, right, or to be felt with their hand. When a patient is told that they have an abnormal mammogram, that's something that I don't want to let fall through the cracks. But there are other things that patients can see too. They may, in an advanced cancer, they may see skin changes, but that is extraordinarily uncommon. The vast majority of our patients never make it to the point where the cancer is so advanced that they can see changes. But in young women that are quite lean, if they have one of those benign lumps that I was talking about, like a fibroadenoma, they can actually see the lump in the breast if they are very thin. The lump just sticks right out.
How are abnormalities found?
The most common way that we find abnormalities is when a patient gets a mammogram. However, that is often not done until in a young woman if they have a palpable mass, or in an older woman once they've passed the age of screening. However, we also have other modalities that we can use, one of which is an ultrasound. An ultrasound can show a variety of different abnormalities. They can show cancers, they can show cysts, they can show fibroadenomas, and they can show normal breast tissue. So it's a very valuable test for us to get if a patient comes in and they feel something. Lastly, we, in some circumstances, use what's called an MRI. An MRI might be used in a patient that we feel is at very high risk for developing breast cancer, but we can't necessarily feel or see anything on the mammogram.
How often should a woman undergo a breast screening?
So certainly in a patient that has a family history of breast cancer, I want them to start getting screened at 40 years old, and I want them to be screened yearly after the age of 40 if there's a family history of breast cancer. But short of that family history, I think that's a discussion that a patient can have with their primary care, and there are many options and no definite right or wrong answer.